Good evening, ladies and gentlemen, and welcome to what is, well, we've lost count of how many Yes Moray meetings we've had since we started having them around about January this year, certainly into the scores. This particular meeting tonight is, has got an NHS theme to it, but nothing's ruled out. If you want to ask us a question about anything, if we don't know the answer, we'll just tell you we don't know, but we'll get you the information in sometime in the future. I'm Sandy Adam, I'm Chairman of Springfield Properties, house builder based here in Elgin. The format for the meeting this evening is, first of all, Dr. Douglas Jarvie is going to speak. Then we're going to have a short 7-minute film about green aspects of the NHS. And then Dr. Philippa Whitford is going to speak. Then we're going to have questions and answers. And then we're going to have an informal session afterwards if you want to hang about and just ask one of us an informal question. That's okay with us as well. So without further ado, I can introduce Dr. Douglas Jarvie, 31 years old, currently a GP in Forres. Douglas is from Dundee originally, studied at Dundee University Medical School, graduated in 2005. He worked with the NHS Tayside for 3 years and then took a year out of his NHS work to work for the Army and spent 3 months in Kenya. Douglas moved to Moray in 2009 to take up GP training and completed this in 2012. He's married with 1 dog. I'm reading this, he sent it. And enjoys a range of outdoor activities including hill walking and cycling. Ladies and gentlemen, Dr. Douglas Jarvie.
Right, ladies and gentlemen, thank you. Thanks, Sandy, for your kind introduction. Thank you for coming here this evening. The independence debate has potential aspects of all areas of public life. Of course, the NHS is no exception to that. So tonight I'd like to talk to you about the NHS and how independence may affect it, and, equally important, how it will not affect it. Firstly, I'd like to give you a wee bit of a background about how I came to be an independent supporter. Originally, until 1995, I was actually brought up in Motherwell, and I saw the closure of Ravenscraig, the devastation of the town and its surrounding communities, and how it blighted the town. In 1995, I moved up to Dundee because my mum and dad divorced, and lived in Douglas, which is one of the poorest areas. Also, there was the occasional bit of jokes at school for that, for the name. And mum was a single mum, she struggled with money, and eventually we did manage to move out of Douglas and go to Moray, which is a somewhat more of a leafy suburb of Dundee. I went to university in Dundee, met many good friends from around the UK and further afield. I also joined the TA, serving as a medical officer, working with soldiers from various backgrounds, serving abroad in Kenya, serving down in England and various places. I worked in 9 Wells and around Tayside, and eventually moved up in 2009, which was one of the best decisions I ever did make. And these experiences are all the things that are put together of what brought me here today, and to be in front of this audience. And in particular, it's my experience of seeing poverty. For a while, directly living in it when my mum was struggling, and now with some friends, with quite a lot of my family, and regularly with my patients. What's shown me is that our society, our government, it does not serve the poorest within it. I mean, sorry. So we are one of the richest nations on earth. Scotland's gross domestic product is over 10% higher than the UK as a whole. And that's the UK, in which the 1,000 rich people are worth 519 billion. Enough to give every man, woman and child in the country almost £10,000 each. And yet in the UK, there are millions in poverty. Hundreds of thousands cannot afford to eat. They're reliant on food banks. We are an extremely wealthiest country, yet for most people it doesn't seem like it. Alongside that, the way the government spends the money is all wrong. We spend billions on projects with no benefit to us, like High-Speed 2 Railway, which only goes as far as Manchester, the refurbishment of Westminster, Crossrail, which is a giant tunnel being dug under central London. London sewer upgrade, we pay for that, even though it's not spending that's related to us. Because these are all counted as UK projects, which means that everyone in the UK sort of contributes to that cost. So in effect, we subsidise London and South East of England with our money. And historically, the Olympics, that counted, and that's in contrast to the Commonwealth Games, which were funded entirely by the Scottish Government and Glasgow City Council. and the M25 and the Channel Tunnel were all similar projects. On top of that, we've got Trident, which is projected to cost us at least £200 million a year for the next 40 years, money that could be spent making people's lives better. So there's an argument, do we need independence to change things? I used to think not, because I thought surely, Labour would help fix poverty. But my faith in that idea evaporated when I saw over the years how Labour sort of had its attitude towards the City of London. I saw how inequality was widening and how poverty worsened. The poor were not just left behind, but they were being actively punished for when things went wrong. A process that accelerated under austerity, which is a programme that's accepted by the UK opposition, who promised to be even tougher. As to the more meaningful powers being involved, I was very disappointed when Calman and this Commission announced with much fanfare we would get powers over air guns and speed limits and very little else. In the past, I had been tempted by the idea of federalism, the idea that Scotland could be a part of the UK, could have the powers to control all the social issues that it all struggled with. And it's a system that worked well in many countries, Germany, Switzerland, Australia, to name 3. But frankly, with this, I thought it's just not going to happen. The only way we can get the powers we need to make the changes we need would be independence. I won't go into the detailed economics of independence here today. That's a huge topic in itself, but I would recommend you to look at the excellent Business for Scotland website. But suffice to say, we already fund all of our own public services, and we continue to do so under independence. And that then is the main point of tonight, the NHS. To give you an idea of what might happen with independence, it's useful to understand briefly how the NHS in Scotland currently works, is organised and funded. Organisationally, it's completely independent of the NHS in England, NHS in Wales, the Health and Social Care Board in Northern Ireland. It's structured differently than elsewhere in the UK, and its operational independence allows us to make decisions, for example, on free prescriptions using our budget. It's answerable to the Scottish Health Minister and in turn to the devolved government in Edinburgh. And that Scottish NHS is funded by the block grant, the amount currently calculated by the Barnett formula. This funds all of our services, such as education, policing, health. It's a fixed proportion of whatever is spent in England, meaning that if English health budget drops, so too does ours. In effect, I say in effect, because technically we have the power to use that budget to sort of spend as much on each individual area as possible, but if we have no control of the total budget, and that total budget is reducing, something's got to give. And worse than that, there's no basis, that formula has no basis in law, it's just a convention. If the government in England chooses to abolish that policy, as one of the current Treasury Ministers has advocated, then they could just cut our budget at a whim, and we have no control over that fact. And the last thing to point out is how the 4 services interact. If someone has an injury or illness in a different part of the UK, the home service, be that a Scotsman in England, an Englishman in Wales, whatever, is billed. Equally, if someone requires specialist care unavailable in Scotland, such as paediatric transplant surgery in Newcastle, to pick one, then the home service gets billed for that. Okay, one common area though, as I said, it's a great example, is transplant care, and I'll come to that later on. But it's this interaction between the 4 health services, the structure created to cope with those interactions and the bureaucracy that's formed in that would actually protect the continuity of care and independence. Essentially what would happen is that where we pay for a service already, then the commercial arrangement would still stand. We would pay for contribution to the organ transplant, to children's service, whatever it is. Because that would benefit us, because it means we get the service and the expertise, and it would benefit the service down in England because they would get the extra funding and extra patient flow that would keep their funded service up and their skills up. So, given that, it's also interesting to note that cross-border funding is very common. It's common across, it exists between the UK and the Republic of Ireland, it exists between states and the EU, with such things as transplant services in Central Europe being completely cross-border. And the European Health Insurance Card is another prime example of cross-border cooperation in healthcare. And the Great Ormond Street Hospital actually looks after patients from 90 different countries around the world. So perhaps a misunderstanding, perhaps a mischief involved. There has been developed, unfortunately, a narrative that suggests that the British NHS will be broken apart by independence. First of all, there is no such entity. There are 4 separate services that work together. And The implication is the care across borders will be stopped, disrupted, ruinously expensive. Indeed, when Vote No Borders, one of the No campaign groups, made an advert and run the cinemas about the Great Ormond Street Hospital saying that we would join a long queue of foreigners, they quickly countered saying, no, actually, service will not be disrupted, it will continue. We look after people from all around the world, it will not change. And when Gordon Brown actually said that organ transplants at risk, there was a letter a whole year prior to his statement which would confirm in writing from the NHS blood and transplant, nothing will change. So, as I say, the structured cross-border care exists. The organisations that most commonly cross UK borders say there's no risk to services, and indeed, as I said, it's in everyone's interest to maintain those services. So, from that point of view, we should have nothing to fear from change. So, in the context, it's the effect of current English reforms and private involvement that actually provides more of a challenge to us and potentially more of a risk to the service. And that's something that Mrs Whitford will be covering in this her part of this tonight's meeting. Also, what I'd like to focus on, though, is the health is not just about the NHS. There are non-NHS aspects of health, in particular poverty, the effect of that on our nation's health, and what opportunities I think independence might provide to improve the situation. Now, in 2013, it was estimated 820,000 people in Scotland were in poverty, and of those, 180,000, or about 20% of the population, were children. That's up 30,000 over the previous year. 1 in 5 of Scottish children in poverty. And of those, 60% of those were in poverty, despite being in a house where one or more parents were working. And according to the Trussell Trust, food bank use went from Scotland from 5,726 in 2011-12 to 71,428 last year, an increase of 1,147% over 2 years. And of those, 31% were children. Reasons for referral included the 30% due to benefit delays, 17% due to benefit changes, 20% due to low income despite work, and a whole list of other reasons. But aside from being stressing, humiliating, and unfair, why is this important to our health? Well, it's well established. There is a risk between poverty and children and poor health outcomes. Start before birth, maternal smoking, unplanned pregnancy, and issues about planned feeding, and often lower birth weight, which is an independent risk factor for poor health. So into early childhood, this continues. There's increased early risk of social, emotional and cognitive problems before the age of 5. Ongoing poverty also leads to increased obesity, increased risk of unintentional injuries, and by primary age, 33% of the poorest children, compared to 7% of the wealthiest children, have developmental problems. Later on, poor children have lower educational attainment, increased alcohol intake, increased rates of teenage pregnancy, all situations that would lock them potentially into future poverty, so it's a self-sustaining cycle. And poverty in childhood, as I say, tends to lead to poverty as an adult. It's a downward trend in health with increased smoking, increased cardiovascular disease, type 2 diabetes, poorer mental health, and poorer all-cause mortality. In Scotland, life expectancies are over 2 years lower than the UK average, and 6 out of 10 of the worst areas in the UK are in Scotland. That's both male and female. And in one particular ward in Glasgow, Colton, their life expectancy is 54, same as Zimbabwe, worse than Malawi, Afghanistan or Iraq. So what can we do about it? People in poverty tend to access health services less. We can opportunistically help them get health with primary, secondary, preventive measures. Often the time people come is time when it's too late. Health consequences have already ensued. With respect to children, health visitor services, school services provide valuable service, but they're overstretched and cannot be expected to alleviate poverty or eradicate issues of, for example, substance misuse or mental health problems that are often consequences of situation that's come from childhood. So, given that, it has often been stated that because we control the NHS and because power has evolved, that we already have the powers to solve the health issues we face, that independence isn't important to this. However, I would argue that that's not actually true. So, there are many ways to improve health without ever involving a doctor. Good warm housing, indoor plumbing, decent sewage. They did far more to improve life expectancies and health than anything any of us have ever done. And devolution offers us very limited powers. Schedule 5 of the Scotland Act, which I've listed here, if you remember the slide from earlier, this is what we don't have control over. So, it's not exhaustive, but things we don't have over which could affect health are drug laws, gambling laws, consumer protection, social security, including pensions, benefits and housing, child support, alcohol and tobacco duty, health regulation, employment law, health and safety, abortion law, transplantation law, embryology, medicine supply, welfare, foods, public borrowing, equal opportunities and control of weapons. Many of these could be used to help make improvements in social health. And one specific example I will cite in detail is social security. We've all heard of the bedroom tax, which meant anyone with spare room in private let, which was introduced by Labour, or anyone in social housing, which was introduced by a coalition, would have to lose a part of the housing benefit, which is 14% of all benefit for one room, 25% for another room. Now, the aim was to solve the problem of under occupancy, also to save money in a housing benefit bill, and also to at least stop the people who needed more rooms, and something, a problem that was particularly acute in South East London, where 5.8 billion or £690 per head was spent on housing benefit, whereas 1.7 billion or £320 per head was actually spent in Scotland. So a massive difference. So the controversy it caused was huge, but the tragedy was this: there were more people who were trapped in houses with a spare bedroom, but they could not move because there was no single bedroom houses available to go to. They had to pay the full rent, so they had to find the money from somewhere. So where? So was it the electricity? Was it the foods? Was it a payday loan? They were stuck. And I had a patient who, unfortunately, her husband had recently died, so the house that he had before with disabled adaptations and everything else was actually too big for her now by the new rules. So she had her own chronic physical and mental health problems, and she was forced to move 15 miles away just to get a house, away from all her friends, away from all her family, away from all the support she had in a family home of many years. So it was a problem. It was not a big problem in Scotland, but it was dealt with by a one-size-fits-all policy across the UK. We had no control over it. So that led to 1,000 people being put into rent arrears, put towards food banks, put into debt. Also forced the Scottish Government and councils to eventually divert millions of pounds from other services on their fixed budget in order to mitigate the policy, which is hardly fair. And if we had power over other policies in this area, we could have avoided this situation. Other benefit recipients, disabled, unemployed, people on job seekers' allowance also suffer. ATOS became notorious for its handling of ESA. Sanctions applied to people on job seekers' allowance meant that people had lost their money, ranging from time from 4 weeks for minor infringements, such as being 5 minutes late for appointments or missing a couple of appointments, to an extreme people having no benefits for 3 years. 3 years. I mean, how can people live with no money to buy food for 3 years? So, the list, as I say, the list of areas we have powers of are extensive. Many of them have direct and indirect effects on health. We could use those powers of independence to make policy that suits our local needs and avoid the decisions that have been made. So, as well as those other powers, we also have absolutely no control over our budgets. Sure, we can shuffle them out and block grant them, and that's about it. So if we controlled all our finances, we could be able to pay for all existing services exactly as is without any problems, but we could change priorities. We could get rid of, say, private nuclear missiles, for example. However, if all we were doing was keeping the same services and paying things, what would be the point of independence in that? Indeed, the Scottish Government had quite a few interesting ideas in the White Paper. They were attacked for their ideas on childcare and sort of trying to encourage people back to work. They had a policy which aimed to get people out of work, so into work, and out of poverty, with hopefully all the positive potential health outcomes that are associated with avoiding poverty. It was ambitious, and it would have cost about £700 million a year on most estimates. And if it was fully implemented, it would gain at least that back, maybe twice that in tax. Cost neutral. It would sound good if it worked. The opposition leaders pointed out, technically correctly, that the Scottish Government could put all those changes in place just now. But what they didn't acknowledge was that the point of the project was to be self-financing. All money raised under demolition would go straight back to the Treasury in London. We would not get any increase in a block grant. It would not actually be a sustainable service. The government spent 2% of this block grant with no return and necessitating cuts to other services. Devolution limits this. It limits us ambitious, it limits what we can achieve. So in summary, I'd like to say this. Scotland is a fantastically wealthy country. If we was independent, we would be the 14th richest country in the world. The financial base would allow us to sustain our existing public services. Indeed, with different priorities and wider powers, we could make them better still. Despite this wealth, however, we have shocking levels of poverty with consequent poor health. We have seen this escalate and are currently severely constrained in our efforts to tackle this public health disaster. So as I say, health is a bit more than healthcare. The powers that independence will afford will allow us to respond to public health challenges that we simply cannot deal with under devolution. It will give us a control over public funding, allowing us to protect our service in the future. More than that, it will give the people the chance to feel the control of their own destiny. As ex-Chief Medical Officer Harry Burns said only last week, that would people in an independent country feel more in control of their lives? If people felt that they were able to engage and make choices more easily for themselves, then that could improve their health. Ladies and gentlemen, thank you for listening.